Hello and welcome. I'm Heidi McCutcheon with the Shelton-Mason County Chamber of Commerce. For 100 years now, the Chamber has been bringing vital resources to Mason County. We know that keeping employees and the community healthy is a priority for the business community. As we approach the 2-year anniversary of the pandemic, we are still faced with changes to guidance and new information being released regularly. What can you expect? Today, we are joined by Mason Health Superintendent and CEO Eric Moll and Mason County Public Health Director Dave Windom, who will speak to trends as well as the challenges and outlook for our local area. They will also touch on how they are partnering with the Chamber to provide alerts and resources to the business community. It is my great pleasure to introduce Eric Moll. Eric has been with the hospital district since 2004. He's a graduate of University of Washington with a Bachelor of Arts degree in Business Admin, go Dogs, and has an MBA from Wharton School at the University of Pennsylvania. He's also a certified public accountant, and he received the 2019 Innovation in Rural Medicine Award as a healthcare champion honoree, and he was named the 2016 Community Health Leadership Award. Eric's volunteerism includes being a middle school mountain bike coach and service in a leadership capacity for several state and regional healthcare organizations, including American Hospital Associate Regional Policy Board, Washington State Hospital Association Board, Washington Rural Health Collaborative, Choice Regional Network, and Washington Hospital Services. So welcome, Eric.
Hey, thanks, Heidi. So I'll just jump right in. I'll first say apologies that I will not be able to stay on for the entire hour. I will have to jump off after the first 30 minutes. And I know largely as the Chamber is setting this up, this is to kind of talk about where we at in the pandemic and kind of trend going forward. And before just kind of jumping in and kind of giving the situational assessment for Mason Health, I first just, Dave Windom, not coincidentally, is also co-presenting with me. And I just want to extend, just the partnership and collaboration that we've had, with Mason Health and public health over the last couple of years. And public health has just been an incredible partner for us and really has made it a collaborative community effort in a lot of things that we've needed to react to, let's put it that way, over these last 2 years. And so just a great team there. It's a small but mighty team. They punch way above their weight, and just really want to extend my appreciation for Dave and his team. So, the snapshot, there's a lot of ways to, think about, what's going on currently. And I'm anticipating Dave will do a much better job of giving the Mason County perspective as he goes next. And so I'm going to keep this more focused on, what have we experienced within the hospital. And, it's really, there's two lenses. Certainly there's the patient and then there's the workforce impact as well. And so those are the two areas I'm largely going to focus on. And I'm thankful to say it's a very different picture today, this month, mid-month, than it was certainly, a month ago. And so, and that's why I'll kind of contrast, to give a sense of how we're doing. I'll contrast kind of today versus a month ago today. And so, right now we have one COVID positive patient in the hospital. And, our census, which is the inpatient number of inpatients we have in the hospital, is still high by historical standards. It's still not what we were experiencing last month and certainly the preceding many months, where last month at this time we had over 10 COVID positive patients, and that was pretty standard. That was for the preceding 3-4 months, where we would typically have an inpatient census. So that's average number of patients that we'd have in hospital beds. Typically pre-pandemic, it was around 13, and then over those previous 5 months, our average inpatient and observation census was trending around 30, so more than double. And so you can imagine how that would stretch, our staffing and resources. But I'm very proud that, incredible team we have up here, really a good group of staff and managers, leaders. We were able to work through that. The other lens to look at this also is, as I mentioned earlier, the employee impact. And so we started, to from a COVID positive within our workforce, that started to become more of an issue, I'd say, going back to third quarter last year with the Delta, and we started to see more breakthrough cases. Largely prior to that time, it was very rare when we had a employee test positive, and then it started to become more normal. And then once Omicron really started to take off, and I have to put a little slight humor in here because I've struggled with Omicron, just saying it right. So that's my little slight comedic aside. I so badly want to say Omnicron, and I would get fairly disapproving, violent reactions from my wife correcting me on Omicron. So I have to chuckle at that. But Omicron was very serious, unfortunately, and that of all the waves, and that's kind of what we continue to experience, is these waves, and the Omicron wave is probably the one that hit us hardest, both from a patient perspective, having an influx of inpatient census higher than what we had experienced in any of the previous surges or waves, but then the impact on staff. So currently we have, and again, this is contrasting kind of current state to where we've come from recently. So currently we have 4 employees that are off due to COVID positive tests. This time last month, we had over 25. And I think that the highest number I'd seen at any one time was 29, and that was in any day. But then you can imagine that has a cumulative impact. And so, it was very, very stressful for the organization on many fronts to manage through the Omicron. So I'd say now, it's one of those where we've had so many waves, and Dave gave me this great analogy last week. Dave, hopefully I'm not stealing any thunder of yours, but it's from his own experience, being in kind of war zone type of situation. Normally then you do your 2 or 6 months or whatever, and then you go and recharge. And I think it's almost like our recharging is when we're in a trough of one of these waves, but not necessarily still a sense of, okay, is there an end in sight? I certainly am hopeful. That's what the experts seem to be talking more about, is switching to an endemic. But again, that's where I'm going to defer to Dave on any of those kinds of discussions, because at this point in the pandemic, I'm beyond prognosis. I'm just kind of making sure we keep good morale, that folks are making it through, that we're supporting people, and we're helping people get through this. And so the other thing is just to touch on financially, just as an aside, financially the hospital district is doing okay. We're managing through. Obviously there's a lot of federal stimulus that that helped and support through this. And I think we're kind of weaned off of that, meaning that in 2020 it was absolutely essential, critical, that we received the federal CARES Act funding. Otherwise, I think we ended up slightly positive for the year, and I believe we received something like north of $5-6 million in CARES Act funding. Whereas by the time we got to the second half of last year, much of our volume started to trend back in a very positive direction. Not just the record-setting inpatient, but in many of our other lines of service, started to see very healthy, positive trends, and so gave me a high degree of confidence that that we are back on stable, as stable as a highly variable situation can be. We're back on stable footing, and that's the thing. There's a lot of uncertainty. Surgical services got shut down through a state mandate over the last 3-4 weeks. So that whole surgical line of work had to be essentially frozen. And we anticipate that we'll be able to come back online and do surgeries this coming month, and then they're work through the backlog there. And so and then jumping to the workforce, I think that's regardless of the industry, and there's a lot of industries represented on this chamber call today, and I think every one of us is feeling a massive workforce challenge, and we probably all would agree that if it's not our top concern or issue that we're facing, it's probably your close second. And so certainly healthcare industry is no exception. And when people ask me, well, how's Mason doing? That's always it's a difficult answer to provide, without going into some depth. And I usually qualify it and say, well, relatively speaking, relative, say, to other community hospitals, we're doing okay, we're doing well. And then I have to further qualify and say, relative to quote ordinary times, this is as challenging as it's ever been. And so and that's kind of the situation where as I speak with my colleagues and other hospitals, we're in this better situation because we're generally able to fully staff our inpatient wings of the hospital and our services. But that doesn't mean that management and the teams themselves are having to work overtime to fill in and scramble to plug holes. And so it's one of those things where we're treading water and keeping up. And so to put some context in that, we have on the workforce side, just to give you a couple areas, we have record numbers of openings for us. And again, this is a relative thing. And so for us, we have 11 MAs, we have 10 RNs that are open. We've never had that many openings before. And then the duration of the openings, is also, whereas in the past, a typical RN, because we're generally considered a really desirable place, a good place to work. So usually when we had an RN opening in the past, again, pre-pandemic, we would close that within a month. We'd be able to fill it. And now it's very typical that extends 60 and 90 days in some cases. And so it's a very different challenge. I think there's things that I'm paying attention to down in Olympia, just quick aside, that could make it an even bigger challenge. There's a House Bill 1868 that where it would create certain mandated staffing ratios, and you can imagine the unions have a lot backing those bills. I won't provide editorial comment on that, other than to say the challenge of it is Washington is essentially a closed state, meaning that the majority of states have what's called a licensure reciprocity. So meaning if you're licensed in a particular state that has reciprocity with another state, you can go across state lines. Washington is one of the few it's a closed state. And so it creates that additional barrier for licensed RNs to come into Washington. We're an awesome place to live. People want to come here, but it becomes that more difficult step. And so if you can go to another a desirable state that you don't have to jump through the several months of hoops, you'll go there. And so I think some of these bills could be, I'll just keep it very difficult to fulfill, those staffing mandates. And so then what that means is more wings of the larger hospitals will have to close because they're not able to staff those beds, essentially. And so that is at least my perspective on the reality. So we have those kinds of challenges, but at the same time, I'm a huge proponent of leadership is about getting results, and so that's our job here is overcome these challenges. It's not to study the problem. It's not to be able to explain the problem. I could spend a whole hour just explaining to you all the reasons why these problems exist, but at the end of the day, it's we have to come up with solutions that will address these workforce challenges. And so that is our largest initiative this year, and one that we've been working on for the past several years and put a lot of work into it last year. And it's this both an RN and an MA development program. And so we're connecting that with our work with the Shelton School District and Health Science Academy. So really trying to connect with the community. And so through this, we're creating this pipeline. And so we had our first RN start. And so we're fully funding their education. We were able to work with South Sound College that was willing to commit and basically reserve 2 slots for Mason County and for us for this program. And just as an aside, to get into RN programs because they're oversubscribed is incredibly competitive. Essentially it's a lottery system. And so so for us to have 2 slots that are reserved for Mason County is huge. And so part of our program, again, working with the school district is, we'll take recent graduates, from the Health Science Academy. We will then fund, their entire education. The only requirement back is, if we have an opening, we think we will. If we have an opening, they agree to come work here for 2-3 years. Pretty simple, depending on the duration of their education. Some RN programs can be done in as quickly as 2 years. Others, bachelor's prepared RNs can take up to 4+ years. And so, that, and if we don't have a job opening, we don't expect them to pay it back. That would just be our contribution to society. One more RN into society, we think is a good contribution back. And so that's one of the things where every year we plan to bring 2 to 3 nurses into this pipeline, and we also will be a training site. We will also have an option and our first that is piloting this as of last month. So we started our first RN, and is we give the option of, if you want to work in the hospital as an RN tech, nurse tech, then we give you the option. And so we'll pay a salary as well and have a position for you. We'll certainly be a training site. And then for those that want to focus more on their schoolwork and their practicum, during this process, then we would provide some sort of just living stipend to help them out. And a very similar program with the MA, but it's more, and that's medical assistants. And those are the positions that work side by side with the providers in the clinic generally. And so those are the ones that are kind of bringing you into the room, doing your initial exam, taking your blood pressure, et cetera, just asking you those basic questions. But they are absolutely the right hand of a provider, and that's also a very challenging part of the workforce. And that one is more, that program and that development program is more like an internship. So or not internship, but apprenticeship, meaning that that they come and work, and throughout that year they go through an educational program, but they're also working full time in the clinic. And by the end of that year, they have developed the experience. They've gone through the classes where then they can take the certification state exam and then be qualified to be a certified medical assistant. And so we started, I believe, 2 last month in that program. And then again, we hope at the end of the school year, this coming June, July, is to bring on some, hopefully a couple of the recent Health Science Academy graduates. And so, so again, those are the things that we're doing to really, push through some of these issues. So just want to share, just kind of that's my perspective on, as I said in the beginning, I wish I could give you a prediction. I would probably trust and rely more on Dave's, prognosis, because right now I think, I'm hopeful, I'm optimistic, as we move forward that, the worst is behind us. But, I think my mindset is just, in terms of leading this organization is, just preparing for anything and preparing people and just really focusing on keeping people together, and working, in a supportive, collaborative fashion. So it's really a lot about collaboration and teamwork, and that's my focus. I wish I could have a crystal ball and be more about prognosis and giving some accurate degree of optimism. But my optimism is, we're going to make it through it. We're going to make it through it together. It's just in terms of how long that takes, I'm prepared for, however long it takes. But I'll stop there, Heidi. And, I have a few minutes if there's any burning questions.
Thanks, Eric. I'd love to hear about the educational opportunities that you're providing. And one thing that I think we've been really blessed to have in Mason County is a very strong healthcare system.
Mm-hmm.
And the fact that you're taking strides to ensure the longevity and the workflow and workforce as things move forward is really great to hear.
Mm-hmm.
I didn't see any questions. So, I just saw one. Okay, Randy, go ahead.
Hey, real quick statement. I think Eric's CV was a little incomplete. He also has 2 twin daughters, juniors in high school, that are nationally ranked and national record holder pole vaulters. And we're hoping we have a full-fledged Shelton Invitational this year, and I'm really hoping that they are there. Anyway, I do have a quick question. Mm-hmm. Of the 25 employees, for example, last month that had COVID, mm-hmm. What percentage of them had been vaccinated prior to them getting it? Thank you.
Yeah, awesome question. And, I think, so I actually had that number once upon a time, but what I can say, Randy, that's a really good question. We did look at that. It was disproportionately higher for the unvaccinated. But, it was, and again, this is what got my attention starting with Delta. I think the severity was different between vaccinated and unvaccinated, but we started seeing breakthrough cases back in August with vaccinated and unvaccinated. It didn't matter, and maybe as we were looking at that data over those previous 6 months, yeah, it's just disproportionately a bit higher with unvaccinated, but yeah, that's where it really started to become a game changer with Delta, which is it really came across both segments. But good question. I apologize for not having that. That should be burned in my brain, but it's not.
I'm sure that there's a number of statistics that at any given moment are up in thoughts. So
right.
Okay, well, I'm not seeing any other questions. So we will let you off the hook. I know that you have another meeting to get to, but thank you so much for taking the time to speak with us today and share with us what's happening at Mason Health and the hospital. And we appreciate your time. So.
Oh, thank you, Heidi. And yeah, thanks for the chamber, kind of bringing this together and hosting this, a really important conversation for sure. And I know now you're in really good hands with Dave, because I left a few blanks out there, and I'm 100% confident he's going to fill in some of them as much as he can. He doesn't have a crystal ball either, but he has a better sense than me. So, all right. Thank you all.
Very good. Thanks, Eric.
Bye.
So next, it is my pleasure to introduce Dave Windom. He is Mason County's Public Health Director. He manages the department's communications, operations, programs, and supports the new strategic direction across building, planning, permitting, and public health. Dave has an MS in health science from Trident University and is a registered on-site septic system inspector. And Dave is also a retired Command Sergeant Major, a graduate of the U.S. Sergeants Major Academy. Prior to joining Mason County, he was the administrator of Northeast Tri-County Health District. Dave has served as president of the Washington State Association of Local Public Health Officials and the chair of WSALPHO Executive Leadership Committee. So Dave, thank you.
That is a big mouthful. WSALPHO, yeah. I was just, as Eric was talking, I was thinking, a year ago, we were out standing in the rain, and I mean a downpour, doing vaccination clinics with Eric's crew. So we had the big drive-through tent, 2 lines of kind of no-stop shots going through there with public health folks and with Mason Health folks and volunteers. And despite the rain and the wind and the really harsh cold, we had a great time. We got a lot of vaccinations done. At one point, we were doing over 1,000 vaccinations a day through that vaccination team work that went out there. So Mason Health and Mason Public Health and our volunteers have been, we're really working hard this last year. I see today, as of today, we finally hit 60% fully vaccinated, and that's all ages. And that's the highest we've been. It's taken quite a long time to get to that 60%. And I'll come to that here in a minute. Heidi, if I may, I'm going to go ahead and try to screen share here. So you should be seeing a slide that says bottom line up front. And this slide is kind of a look at really the last 6 months, a little more of COVID here in Mason County. And, we quit looking at cases per day as a measure of what's going on, because they fluctuate so dramatically. I get asked the question a lot of times, why don't your figures agree with DOH's figures? And a lot of it's because of the way the data is transmitted. People get their lab tests, goes to DOH, comes to us, and we don't always get it in a timely way. And sometimes, as this first graph shows, we had a really straight up climb on Omicron, and very little hang time at the top, and it came back down. You see we have a bump on the right hand side of that graph. Well, the bump really is cases that were double counted. So DOH is in the process of sorting those cases right now and eliminating the double counts, and you'll see that graph change over the next week as that gets updated. But it is an interesting graph in that you see from July to about the 1st of January, we had Delta, which peaked, and then it just kind of bumped along like kind of a sawtooth thing going along for months. It didn't really come down much. Then Omicron hit and really rapidly replaced Delta and took off like a space shuttle, went up, like I said, didn't have a lot of hang time. It's coming back down. And really over the last couple of weeks, we've seen a dramatic decrease. And I'll come to that here in a second. We are seeing that the number of hospitalized patients and deaths has remained about the same. So there's good news there. Hospitalizations down about 4%. Deaths over the last 2 weeks are 14. And test positivity was up as high as 67%. So think of it as people who felt symptoms and they went to a hospital or they went to the hub up in Eureka and got tested with a PCR test. 67% were positive, so people were pretty aware they were sick and they were getting tested. The test positivity is coming down, which means that people are having symptoms, but the symptoms could be from other things. So we've got strep throat and staph and some other things going around. Colds, I mean, we've got colds going around. And then at the bottom, you see fully vaccinated, we're at 60%, 5 and up, 63%. And where we've done a really good job is our 65 and older, we're at 84%. So we're really cocooning those folks that are in their later years. So I've done a good job there. Next slide. Let me put this into slide mode here. Oh, wow, buzz through that. Slides are back. Okay, so we're running an average of 41 cases a day in Mason County, and that's 71% decrease since last or 2 weeks ago. It's huge. I mean, that's some of the best news we've had in a long time. I'm so pleased it didn't go up and then bounced along like Delta did. So Omicron is certainly a different kind of a variant, and it really mimics more of what we expect to see in a virus, where you do have a rapid increase, very little time at the top, and a rapid decrease. It should be parabolic. And Delta just was not that. Delta was completely different. It came and it stayed for a long time. We're about 1 of 6 residents, and that continues to go up because it's cumulative. And I think what we may start to see is that between vaccinations and people who've had COVID, if we get this new variant, which is the BA2 variant, or they're calling it stealth variant, there may not be a lot of people left to infect. So, and that's kind of what we're hoping as we go forward. Moving on. So this is since the beginning of the pandemic. So we've got deaths, a 7-day death rate. You see, we had a real spike in December. That was kind of at the end of Delta. So Delta was pretty severe. We had people across the state, a lot of people on ventilators and had a lot of problems. And here in Mason County, we had a pretty high death rate there for a while. Omicron came in and replaced Delta. We peaked up, but we stayed below 10 deaths per week. And right now we're at 6.1. So if you think of it that way, if we were 100,000 population, of course we're not, but if we were at 100,000, you could expect 6.1 deaths per week. And we're kind of tracking right on that. We're at 14 deaths over 2 weeks. So the data is like a cross check. It seems to be checking out. This one's interesting though, hospitalizations. So hospitalizations are a little different. You see how when we first started out, we had some hospitalizations. January 21, another bump. July of last summer, I remember after we declared victory across the state, well, Delta came along and put that to rest. And we had a lot of hospitalizations up and down across the board. And then we got into, we're starting to come off of that, Omicron hit, and we had a lot of hospitalizations. And that was pretty dramatic. Part of that, we got very close to exceeding our capability here in the hospital. Now, across the lower Puget Sound region, there were a lot of hospitals that were at capacity. Mason General stayed right at capacity, but we never really had to exceed it. We've had cases like this in the past. In 2018, we had flu that was severe that we were actually shipping patients as far as Portland to get them into hospital beds. So this is really successful for us. Our staff beds were able to take care of the hospitalizations that we had coming our way. So this has been an interesting ride. A lot of our hospitalizations are those folks over 65. We've seen a lot of that. Our hospitalizations are far more with the non-vaccinated than with vaccinated. So the people who are vaccinated or who have had COVID in the past have had lighter symptoms. They have not gone as heavily into the hospital. So there's a misnomer out there in the media when they say Omicron is mild. And from a medical point of view, mild means fewer cases going to the hospital. But what has happened is because it is so infectious, even though it is milder and fewer people are going to the hospital per 100,000, because there is so much more, the math just works out that we have more people in the hospital. That delta between the two just slides up the scale, and we have more people in the hospital. So that really explains how high why our hospitalizations were so high with Omicron. They are coming down now, and that is good news. It's nice for the first time in a long time for me to come out and say, hey, we got some good news around COVID, because I've been like Dave the bad news bear for a long time. This one was interesting. I thought I'd bring this out. We've got this is children from 0 to 20. And part of the graphic didn't come up, but that teal colored line are kids from age 12 to 19, or 12 to 18. And you see, we've got, this is across the state. This is not Mason County, this is across the state. I'm gonna be very clear about that. And then the next line down, surprisingly, is the other end of the spectrum, is the 0 to 4 category. And that was surprising to me. And then we have the 5-year-olds to 11-year-olds in the purple. We're kind of chugging along at the bottom. You see, through most of the pandemic, the different groups kind of were aligned, but boy, when we got to Omicron, the teens really shot up, and then the little kids shot up as well. So more in the hospital, but I need to put that in perspective. If you look over the right-hand side of the graph, you see that hospitalization rate is 10 per 100,000, whereas we were talking in case rates, we're talking 1,600 per 100,000. So the rates of kids were very low, but they had increased dramatically over what we saw previously, which was kind of surprising to a lot of us. It's kind of follows the same track that H1N1 did back in the mid 2000s, and in that it started off with older groups, but then H1N1 became more prevalent in the 35 to 45-year-old category, and it really settled in there. And this looks like it's kind of settling in on our youth, so that's a little disconcerting. But again, it's coming down dramatically. It's almost a vertical drop too, so that's also good news. All right, here's where things start getting a little bit weirder. With the governor plans, last week the governor announced that surgeries are back on for starting February 18th, and that was great news. When the governor, in his last announcement before that, took surgeries off the table, I was scheduled for a surgery, and while the governor was still speaking, I got a call from Mason Health saying my surgery was canceled. So very efficient up there at Mason Health. And then last night I got a call from Mason Health saying, okay, Dave, your surgery is back on and let's schedule a date. So kudos to Mason Health. They are all over this. It's just, they've got a great surgical team up there, and their schedules are just on top of what's going on. The outdoor mask mandate coming off at the end of this week, and that really didn't apply to us here in Mason County that much because it really affected groups of over 500. So think Oyster Fest, which didn't come off, think Forest Festival, which is coming up, and then the Christmas parade could have fallen under that. We did that differently this year, which was kind of a lot of fun actually. But not a whole lot of change in that category. What's going to change is the change to the indoor mandate. So as of right now, there's no change, but we expect the governor to be on at 2 o'clock to announce what he's planning to do. As most of you know, California is taking their mandate off. Oregon is taking theirs off as of the end of March. So we're looking to see if the governor has some sort of what his will look like. Now, if he does like he did last summer, this is how it looked. If you were vaccinated, using the fully vaccinated criteria, and I can talk about that in a sec. If you're fully vaccinated, you could take your mask off indoors. If you were not vaccinated, you had to wear your mask, but in either case, you had to show your employer if you were vaccinated or not vaccinated. At that time, there was no provision for those who had COVID to have that count towards their immunity status. So some of us have pushed the governor to talk about, instead of vaccinated or unvaccinated, talk about immunity, using immunity as kind of the standard by which we measure things. It's harder to do because we don't know right now the level of antibodies it takes to provide a protective factor. So that's still under study. We hope to find out more about that as time goes on. There's a lot of studies being done. Like I said, we should have an announcement today on the indoor mandate. King County is relaxing the vaccine mandate for restaurants and bars. That was as of yesterday. So that was a new announcement from Jeff Duchin and the new mayor up there in King County for Seattle. So that is coming off. We still have to the north of us vaccine mandates for bars and restaurants in Jefferson and Clallam counties. I'm not sure what their health officer is going to do. We will know more on that probably late this afternoon because we're meeting with all the health officers. So throughout the pandemic, we've been meeting with health officers every week and then with DOH every week to talk about these big things and to try to get some feedback to the governor's office through DOH channels about what we're actually seeing on the ground and trying to influence some of the decisions that come out of Olympia that in some cases make sense for large urban areas, but didn't make allowances for rurals and the different circumstances we find ourselves in. So we're hoping that our pushback this week will be heard by the governor's office, and I guess we'll find out here in a couple hours. Next slide. All right, near and dear to everybody is testing. So 2 weeks ago, we put out 20,000 masks. So we had the N95 masks. We got a shipment of N95 masks, which unfortunately were short dated. So we didn't even put them into the warehouse. We just unpacked the pallets where they were and got them out to the community. So it went any number of places. We put that out on social media for people to go pick up N95 masks. Unfortunately, they were one size, but it's what we had. So it's what we put out. I did order 40,000 test kits through the state. We've received 14,000 test kits from the state. And then I had ordered 9,000 test kits out of a fund that I had available. And that first batch of test kits came in with a printing error or labeling error, we'll call it a labeling error, on the boxes. And I had to send those back because FDA had considered them to not be available for use for what we were trying to use them for. So sent those back, ordered another 9,000. So we've got kits in. This last week, we got a bunch of those kits out. We sent them to Hoodsport, Belfair, Shelton. We got them out to a lot of different places. And you can see that on social media as well. And then for county employees, we had a situation where we could do 1 kit per person, 2 kits per family, and I had a couple of collection points for those. This group of 9,000 test kits that we just got are a little different than the other ones in that they're single test boxes, but they have really good instructions in Spanish and really good instructions just using pictures. So we're going to use a lot of those kits to reach out to some of our non-English speaking county residents and then get them out to employers, especially employers that have a large number of immigrant employees. I think these test kits will work really well for them. So we'll be getting those out this next week. Part of the advantage of coming here to talk to you folks is to kind of get some feedback. And that's why, as soon as I wrap up these slides, is to find out, kind of who's needing what and kind of get some feedback on where the community would like these tests to go. Because we've had great support from the chamber and other folks, but didn't get around to everybody. I mean, we had the initial batch was fairly small. Getting test kits out to employers is going to be our next one. And then again, support for skilled nursing facilities, because they do go through a lot of test kits. We're not supplying a lot to the schools unless they run out, mostly because schools have their own pipeline that's being filled through the OSPI. So not doing as much with schools, like I said, unless they run short, and then they're certainly welcome to get a hold of us. So we are using test kits to support some activities that are coming to Mason County. So we've got some, I would say conferences, but some groups that are coming to Mason County, and we want to make sure they have access to test kits and masks as well. Testing update. So the states opened up their Say Yes to COVID test site. Initially, they had it out there and it was sold out within 8 hours. They've got some test kits in again, and that is out there as well. So that is an antigen test, which is actually my preference for using for testing, in that it really shows me as a public health guy who is contagious. PCRs, tests like we do at the labs and at the COVID center, at the hospital, and at the hub in Belfair, are a much more sensitive test, and they can really show us that you've had COVID. My concern really is about who is infectious at the time. So a test that's just as selective and less sensitive, like these antigen tests, these home tests, really tell me who is infectious and when. And for us in public health, that's really kind of the important piece. And then we're going to be coming out with some processes for these test to priority groups this next week, and that my next slide will kind of cover where we're going with that. I realize I'm going through a lot of this really fast, so if you have questions, hang on, I'm almost through. So case investigation. So since the beginning of COVID, we've done what's called case investigation and contact tracing. And Monday at 7:45, we were told that as of 8 o'clock that morning, DOH was closing much of the CICT activity. So it was very little advance notice to us. What they're still going to be doing, though, is investigating outbreaks. So if we have outbreaks in skilled nursing facilities, jails, prisons, nursing homes, we'll be investigating those. And then still investigating unusual cases. Let's say we have an outbreak amongst kids that strikes us as being unusual, that's not epidemiologically linked. We'll be looking at those. And then folks over 65 years old are going to be investigated as long as the sample is less than 4 days old. You can get a call probably from DOH or from us on those. But they'll not be calling and notifying most cases that turn up positive that go through the state system. Now, the home kits don't go through the state system. For the most part, people don't call in and the state say, hey, I have COVID based on my home kit. And the state is really taking an approach that we're going to take this to an endemic instead of a pandemic. So endemic like flu or like colds, those sorts of things. We're really kind of using the flu model that if you use a home kit and you find that you are positive in the home kit, it's going to be up to you to notify people around you, your close contacts. The state's not going to be doing that. So we're really kind of be transferring a lot of the responsibility for managing the disease back over to the patient, back over to people, give people power to do that, give them the test, give them the masks, they have access to vaccine, and to try to build those layers of protection. So think of it as layers of armor. You've got a vaccine, you've got a mask, you may have had COVID. Each of those builds on each other to provide more protection. So what do you do if you've tested positive? We've got this guidance out online. What do you do if you've been potentially exposed? And I get tons of phone calls at home on these things. People are very concerned about, especially I think a lot of the churches, a lot of the social groups call me at home to ask about this. And then there's going to be some guidance for daycare, schools, et cetera. It's going to change based on the mask guidance that's going to change. So if the governor changes the mask guidance substantially, we'll need to change how we talk about isolation and quarantine. And as soon as I wrap my head around that, I will get that out there. We're assuming that everything right now is Omicron. We're watching for BA2 to come out. We've had 2 cases of BA2 identified in Washington. And people need to understand that in testing for these things, it's like testing a chocolate chip cookie for chocolate chips. It's a random sampling, and you may hit a chocolate chip or you may not. Same kind of a thing with these. We may hit a BA2 case and we may not, because these are random samples derived from the larger sampling set. And the newest test kits, like I said, have excellent instructions in Spanish, and there's a single test per box. So it gives us a little more flexibility than the early ones we got, which were 5 test kits per box. And then, like I said, we'll change some of may change some of the quarantine and isolation guidelines based on what the governor has to say this afternoon. Okay, that is my last slide, and I'm going to stop sharing. And we're back over here. So I've got some time for questions. I'm sure there might be some questions out there.
Thanks, Dave. Really interesting information. I did get one email question that asked if the tests that are available, do they work for, say, going to King County in a restaurant right now or Clallam County? Are they valid tests? If you get if you got a negative, could you go to a Kraken game?
So unfortunately, no. So we call them the home test kits, the antigen test kits. No, they don't accept those, because I mean, you could have one in your hand that somebody else did. So no, what they're looking for are the PCR tests you get an actual lab result that goes to the state and then comes back to us through the state system. And then you can set it up so it notifies you on your phone. You would have your test result on your phone. You can take to those sorts of events. Like I said, those are coming off in King County. So right now, the only two I know of are Jefferson and Clallam County that have those restrictions.
Good. Anybody else with questions? I'm not seeing any hands. Oh. All right. Randy, what's your question?
I really like all of your stats and graphics. They're very cool and interesting. Always really enjoy those. A couple of quick questions. The first one is, as you know, Johns Hopkins had a study, and if I'm remembering it correctly, they concluded that all the closures and quarantine that happened, compared to if none of that happened at all, the difference was negligible, whatever their metrics were. So if you have any comment or insight on that, that'd be great. The second question, a couple of times you referenced.
Randy, why don't we go ahead and let him answer that real quick before you move on to your other questions?
Sure.
Sure. So yeah, I looked at that study, and keep in mind that study was done by 3 economists. It wasn't done by 3 epidemiologists or doctors. So they do take a different view on what they would consider effectiveness. Now, with that said, if you look at a normal epidemiological curve, I hope you can see my hands, they tend to go up sharply, hang at the top, and come down sharply. That's normal. We expect to see that. Flu season looks like that every year. So it's something we're used to seeing. What happens when you put in NPIs, which is non-pharmaceutical interventions, is that it retards that. So if you have an epi curve that looks like this is very, very dramatic, up and down, there's a certain amount of area underneath that curve. What happens when you put an NPI, especially lockdowns, is the curve does this. It flattens, but it comes out further. It's still about the same numbers underneath that curve. It just takes longer to get from one end of the curve to the other end of the curve. So what we saw, especially with the lockdowns early on, is probably no less numbers of infection, but it took longer to get across that infection window, which is what we're trying to do to keep the hospitals from being so overwhelmed early on. Omicron behaved like what we had hoped to see all along with the other ones, steep and then back down. And so the study has its positive points. The study has some biases built into it too. I hope that answers your question.
Yeah, that's great. I may follow up with questions later personally, but I don't want to bore everyone else. But I figure I don't feel guilty about asking a second question. Looks like no one else is gonna in line. But the second question is, you did reference a couple of times the vaccine and also people that have recovered from COVID that have natural immunity. Could you comment on, is there a comparison? Do you have an opinion on like the safety of one group versus the other, and what one group maybe is allowed to do compared to the other? And I think you referenced that a little bit, but anyway, that's my question, and thanks for the time, Heidi.
Sure. So I have been following a study out of Spain now for actually over a year, where they took two groups. One had been vaccinated, one had not, and followed them over the course of time and looking at the protection. And what they were finding is that the ones that had gotten COVID, and that was the control group, they were seeing the antibodies starting to wane pretty dramatically by month 5, and by month 6 they were at less than 50% antibodies compared to within 4 weeks after they had contracted COVID. So the antibody numbers came down fairly quickly at 5 months, 6 months. The response for vaccines, what we're seeing is, surprisingly, it's starting to wane. It looks to me like at about the same rate. So they're still doing some studies on that, and that's kind of why we went to the boosters, is because it seemed like the effectiveness of vaccines started to wane at about the same rate. So that's why I was talking about, you kind of you build a layer of defense I think probably the best bet is that if you've had COVID, to get the vaccine as well, to add another layer of protection on that. I think over time, what it does is it prevents you from really having severe disease. And that's the thing we're really trying to avoid, is avoid hospitalizations, avoid deaths. That's probably the biggest thing we can do right now. Because Omicron seriously has dodged a lot of things we had in place. People got sick even though they were vaccinated, but they weren't getting as sick. So I think that is a success.
Thanks. Can you comment on since someone else is asking, what about the Israeli study? Do you have any comment on that real quick?
I haven't really followed the Israeli study that much. I followed some things that came out of South Africa, and it was really around Omicron. But it's kind of a apples and broccoli comparison with South Africa, because they had such low vaccination rates. They were down like the 22% vaccination rate, where we're around the 80, 85%. So really didn't compare very well.
Well, I am not seeing any other questions. Give a last call just in case there's anybody out there. Okay, so with that, we'll go ahead and call it a wrap. Dave, thank you for your time and for sharing with us today.
Thanks for having me.
Appreciate it. Oh, it's our pleasure. And I'm hopeful, is it okay if we get a copy of those slides from you so we can post it with the presentation, or?
Just shoot them to you right away.
Okay, perfect. All right, so with that, we'll go ahead and call it a wrap. I hope that all of you that are attending found the information provided by our local partners to be helpful and insightful. The Chamber has been providing our members with access to vital resources like this presentation since 1922, which is 100 years now, just a couple months ago. Please remember, as we continue to navigate the impacts of this pandemic, that we are here as a catalyst for business growth, a convener of leaders and influencers, and a champion of the community. If you need help or resources such as masks, tests, etc., we do have those here at our office. Please don't hesitate to reach out to us by phone at 426-2021. Or you can email us at info@masonchamber.com. Again, we will have today's presentation and speaker information up tomorrow at masonchamber.com. So thank you for joining us today. We're glad to see you even remotely, and wish you all a good rest of the week. So thanks again, Dave.
Thanks, everybody.